I'm alive because
I'm alive. I have my 5 awesome kids. I'm alive.
I'm still alive today because I heard your podcast.
Hi everyone, welcome to the I'm Alive Because podcast. I'm your host, Sara, and today we have maybe the most special guest of all time in my book. Her name is Tori, and she is my wife. She is joining us on the podcast to talk about what it's like to be married to someone who struggles with their mental illness, what it's like to be in law enforcement and be surrounded by people who can be struggling with mental health disorders or substance use, and really just to hang out with me and entertain me because she kind of gets pulled into all of my projects. So I hope you'll stay tuned, get cozy, and listen to my interview with Tori. Tori Beth.
Hi.
Welcome to the I'm Alive Because podcast.
Thanks for having me.
Thanks for coming back and podcasting with me again.
Always.
Okay, so same situation here. Tell everyone who you are, what you do, and why you care about mental health.
My name's Tori. I am Sarah's wife. I am a corporal at the sheriff's office here locally. And why I care about mental health, one, because of the work that I do, but also because of Sara being so involved in it and trying to promote it as much as possible.
Yeah. So I just realized when you said that, like when we first started dating, I was not as kind of big into advocacy in the mental health world as I am now.
Not at all. That's definitely grown over the years. And I think that it's made me look a lot more into it and also be a big advocate for it at work and in my personal life.
What has that kind of transition been like for you? Like 2 years ago, I was still kind of in the closet with my own mental health struggles.
Well, I think it's been a really positive transition because you, as you say, coming out of the closet with your mental health struggles, have progressed in your own mental health. And that's helped you, I think, a lot in how you advocate for other people, and that you do advocate for other people a whole lot. And I think that helps you all on its own outside of what you're actually doing to help yourself.
Yeah, for sure. Okay, so you're here to talk about what it's like to be the partner of someone who struggles with mental illness. Also want to dive a little bit into your professional life just because there's a lot kind of going on there as well.
Yep.
No one on the podcast has yet kind of heard my mental health struggle, at least on the I'm Alive Because podcast. So should I give them the spark notes?
Yes, yeah.
Okay. And a 30-second spark note or a 5-minute. What are we?
However you want to do it, but spark
quick.
note. Yep.
Okay, quick. So started struggling really young. Didn't have access to the right mental health supports. Definitely never had a diagnosis until I was 23, 22, the correct diagnosis. So my mental health service history involves an inpatient hospitalization at 18, several intensive outpatient programs that I would call semi-successful at the time, in that I learned a lot of great skills but was never really ready or able to apply them. And then really these last probably 18 months I've been able to do really good intensive work in a local DBT program, which stands for dialectical behavioral therapy, and really get on top of my eating disorder struggles and feel like we're at a really great place for my recovery.
I would agree.
Those were quick spark notes.
Yes, they were. That was from birth to now, really fast.
Really fast. So what has it been like for you to kind of follow that progression over the last 2 years?
I think to start, it was really hard. When we first got together, obviously I didn't know all of your struggles with mental health, and slowly finding out about them, maybe not always in the best ways, was really difficult. And then learning like my place in that and figuring out when and how I could kind of push you in the directions that I thought would be helpful, took a while to figure out. You pushed back a lot on some of it, so it was hard knowing like what was appropriate and what wasn't, especially when we were still newly dating and I was figuring out things that you hadn't told me and you were telling me things that I didn't know.
Did you just like start Googling things?
A little bit. I think I had an idea of some of it, but yeah, I didn't have an idea of everything. When I learned about some of your struggles with your eating disorder, I've had past experience with that, so that was kind of a little bit easier for me, but that was also harder for me to watch than anything else, and that was what you really pushed back on at the time. So that was an interesting dynamic, I think, for us when we were still newly together. But definitely with all of the other stuff, yeah, there was a lot of Googling and trying to research and figure out the best ways that I could help you.
Yeah. Well, and when we first, correct me if I'm wrong, when we first started dating, which was in November, I had just like 3 months prior been having to go to the hospital for the eating disorder, get all of my like tests done that I never followed through with. Like I was supposed to.
Right. And I didn't know any of this.
I never went to the cardiologist for a follow-up after because I was supposed to, but I was like not, yeah.
Right.
So it was still a mess, basically, is what I'm saying.
Yeah. And I think you were still very much not even wanting to deal with it. And then here comes me wanting to go out all the time and wanting to take you out. And it was a really big struggle for a while. And then it was the holidays, which is a whole nother struggle, especially if somebody has an eating disorder. And it made me really angry at times because I would try and help and you wouldn't let me. So that was really difficult at first, I think.
Yeah. I remember like secretly counting my calories and hiding it from you.
I remember that also.
God, thank God those days are done.
Yeah.
I just had 2 pieces of cake and feel no guilt.
It's good. It's really good.
Okay, so eating disorder aside, some of the other things. I mean, I think that for you, right, that was the thing that you could most understand because you'd seen it. But being around my, like, mood swings and my, like, perceived feelings of, like, abandonment, rejection, like, those were really hard at first.
Well, and I think for a while I didn't know that it was like a mental health diagnosis related. So I had no idea if this was just your personality or if there was an underlying thing that was adding to it.
I mean, disordered personality is my personality.
I know that now.
Let's just make a joke about that.
But it was really hard because I didn't know a lot of that, and I didn't know a lot of your past either, so I didn't know a lot of the feelings of abandonment and how easy it was for you to feel like that. And so if we would argue or something would come up and you would tell me that, I would just get frustrated because, well, I'm not abandoning you, and whatever I just did had nothing to do with abandonment. And I think even now I still sometimes get frustrated with that because it's not about that, but reminding myself that that's how it makes you feel is taken a lot for me to figure out, I think.
Yeah. Yeah, no, that has not been easy stuff. I think I'm at the best place now I've ever been where, like, I'll go to that feeling of, oh, you're leaving or you're going to leave or whatever, and then I can take a little bit of a breath and be like, okay, wait. Yeah, learning to just be able to take that breath has kind of soothed some of those abandonment issues in the moment so that I can kind of not have a really bad day with you.
Right, yeah, I agree. I think it's helped for both of us for sure.
Yeah. Thank you, therapy and medication. Okay. So what advice do you have for partners who are with someone who's struggling? I want to kind of tackle this like across the span of a mental health struggle, right? So like, what advice do you have for someone when the individual that they love or they're supporting is like doing not so great, maybe near crisis? What kind of advice do you have for people when they're like in recovery and just need to kind of maintain?
I think the biggest thing for me is not pushing so hard that the other person is like even almost more rebelling against it because you're really pushing the issue. Learning like where those lines were took a long time for me because I just wanted to be like, you need to go to therapy, you need to do this all at the same time, and that was way too much for you and wasn't helpful for either of us. So knowing like I can be encouraging in small amounts and that still be helpful in the moment, but I don't need to make you do it all right away because it takes time. And I think that's like the line for me, like figuring out where that is. But then there's a difference if somebody is in crisis in that moment, and knowing, is this enough that I need outside help in that moment, or is it something that we can kind of handle together? And I think you and I have pretty clear boundaries of when I am going to call somebody else, and what that looks like. And I think that everybody should have that. Like if you have a partner that struggles with mental health, having that conversation about at what point in a crisis do I need to involve somebody else? And you both need to be on the same page about that so that later on, if I do that, or that is a thing that happens, that you don't come back and get mad at me for involving other people.
Yeah. That's never had to happen in our relationship, so I don't even know like what that would. I guess the only reason that we would ever have to ask for some outside help would be if there was any active suicidal planning or ideation, but I'm so far from that right now.
Right. But that's the thing is even if there is ideation without planning, knowing what the line is, right? Mm-hmm. Like if there's a person that you're trying to help and it's maybe something they talk about on a regular basis, but there's not any planning, and you know that this is something they talk about a lot, like knowing what the line is, right? Like if they talk about it every day, but you know that that's not quite their line, but then all of a sudden here comes a Tuesday and they start talking about an actual plan and that's not something they've ever done, well then you need to have an idea of what you're going to do.
Yeah. I will build into the show notes for everyone listening the National Suicide Prevention Hotline and Crisis Text Line, just so that you all have that resource. And I recommend programming it into your phone. That is one thing that I've been able to advocate for myself for maybe twice in our relationship, to be like, Tori, I need you to leave me alone because I'm texting the crisis line right now.
Right. And I think I know that that's something you need to do without me sitting right there or without me trying to help.
Yeah, no, go away. That's really good advice. How do you, this is something that I know you struggle with because, one, you're in law enforcement, and two, I think it's just a part of who you are. But how do you kind of lose the need to take care of me all the time when you know that I can't always be taken care of? Like in your ideal world, if I'm struggling with my mental health, you will just fix it because you're a fixer.
Yeah.
And you can't, right? I mean, that's
right.
Been for you, like, I think something you've really had to grieve in our relationship now, our marriage, is the idea that you could just fix everything for me.
Right.
So how have you done that?
Well, I think that I've always thought that I could fix everything in general, not just for you.
Oh, gosh.
I think that's a strong personality trait of people in law enforcement too, that like that's our job. We walk into a situation that sucks for everybody involved and we somehow fix it. It's not always like the way that people want us to fix it, right? But we're going to fix it so that everybody's safe. And in our relationship, I think it's the same. Like, I want to fix everything so that you're safe and happy and feel good about us and your life. But I can't do that. And that took me a long time to realize. I think when we were still figuring out, like, what my role was in helping you, because I do play a role in helping you in some aspects, but not as much as I want to a lot of the time. I think it helps for me that, like, you go to therapy and then you tell me about it. Like, you tell me the things that you talked about, you tell me the things that you're working on. And I think if somebody has that personality, having a partner that does that would probably be super helpful for them also. Because I then know what you're working on. And so, like, if I see a behavior that maybe you told me you were working on in DBT or in therapy this week, then I can try and help you fact check that behavior without being super pushy and just saying, hey, aren't you, like, not supposed to be doing this or something? I'm not totally sure.
Yeah, right. That never works.
Right. And I do get kind of pushy sometimes, depending on what it is, especially if it's something you've been working on for a while and you've been doing really good with, and then all of a sudden, what the hell is going on? But the more that I know about, like, what you're doing outside of my help, I think helps me realize that I can't fix it all, and I don't need to fix it all because you're doing just fine.
Yeah. Okay, you mentioned a DBT skill for everyone.
Fact checking.
Maybe not everyone knows what fact checking is. Do you want to give them the rundown?
I mean, you could probably do it better than I could, but I will try. From what you've told me, because I haven't done it myself, but you, like I said, explain things to me often. Fact checking is, say you're working on this behavior, we'll say abandonment, because that's a big one for both of us. And we're in an argument, and I want to walk away to avoid the argument, but you want to yell at me for abandoning you. It's kind of like you were talking about earlier, taking a second in your own mind and saying, is Tori really leaving me right now, or are we just taking a break from the current conversation?
Yeah. Super helpful.
Yes. Yes, it is.
Turns out our head is like a big fat liar sometimes.
Yeah.
Yeah.
And it's hard to learn how to do that fact checking in those moments that you're upset.
Oh my God, it's been so hard because for me, it's been 25 years of behavior to completely change. Right. I mean, I've spent my entire life believing these lies that I told myself.
Right.
And now there's an alternative. Like what? Had no idea.
Yeah.
Okay. How do you take care of yourself? Because there's been moments I've, like, been in the middle of my stuff, right? I could just imagine myself, like, on the floor crying hysterically. And sometimes I'll have this, like glimpse of reality for a second, and I just, like, look up at you and you look so broken. And everyone listening probably thinks our life is, like, completely bananas, but really we just...
It's not.
No. We just bake and hang out with our dogs and go to bed before 9 most of the time.
Yeah, or like grandmas for the most part.
We're total grandmas. But that's not what this podcast is about, right? So on the rare occasions that I am kind of really in that struggle, I can just picture, like, there's been these moments where I've seen you, right? And I look up at you and you just look so broken. You look so sad. And it's not like that all the time. But how do you take care of yourself?
I think sometimes it's really hard because I want to take care of you first. And in those moments, I'm always going to take care of you first, no matter what the situation or the crisis, or maybe it's not a crisis yet. But it does suck watching you be as upset as you are at times. And I think a big thing for both of us is learning when I am allowed to walk away. Like, I am not leaving you, I am not abandoning you, and I never will, but I'm going to walk away for a few minutes because it's what I need in that moment. And I don't ever do that if you are really upset, because I'm not going to do that. But if it's in an argument or if you're mad, sometimes that's what I need. And after the fact, always, like, taking some time for myself. So maybe I do stick it out in that moment, and then we're good and we're both feeling all right, and then I'm going to go run errands, or I'm going to go take the dog to the park by myself, or go for a walk, that kind of thing, so that I just have like a little bit of time to myself.
Yeah, I think that giving yourself permission to be, have your autonomy is super healthy.
Right. And I think you and I are really good at that. Like, we do our own thing often anyway, but knowing when we really need to do our own thing in those moments, we're both pretty good at recognizing that.
Yeah, I agree. Okay, as much as I'd love to talk about us, I do want to ask you about your work. Although I have one more question. Well, I have a lot of questions, generally. Always. Okay, maybe I have two. They're related. What is it like for you? Because you are in a professional field that doesn't talk about this stuff where you guys are concerned, right? So, like, cops don't talk with cops about their PTSD, their trauma, the mental health of their partners, and,
right.
The shit going on at home. That's, like, not what it's about.
Right.
So what is it for you? What is it like for you to have a wife who's super open about my mental health struggle, like on social media or with your family? Like, what is that experience like for you?
I definitely think sometimes it makes me nervous, like what other people will think. Like, will they be judging me? Will they be judging you? Like, our marriage, that kind of thing. But then I also think, like, it's the 21st century. And if they are judging us, like, that's their own problem. There's so many advances in, like, training of law enforcement professionals, especially when it comes to mental health and mental health crisis, because we generally are dealing with people in a crisis at the time that we're encountering them. But in general, people in law enforcement are getting more comfortable with it, getting more comfortable with talking about it. I don't have an issue myself, obviously, talking about it at work. I have my friends that I talk to all the time about stuff with us and stuff with me and all that. And I think it's just picking and choosing who you trust and who you want to talk to about it.
Yeah. So you don't have this, like, deep-rooted shame about me?
I am not shameful, no. I still have my moments when I'm like, everybody's gonna judge me, but I talk myself in and out of that and realize that it doesn't make a difference.
You're so sweet. Okay, enough about us. Tell me everything about mental health and law enforcement. So you work in the jail.
Yep.
But you're also on the CNU team, which is a crisis negotiations unit that goes on, like, emergency call-outs.
Yep.
So that's not in the jail. That's out in the community. And obviously, so many people who are incarcerated or involved in the, like, justice system have gotten there because of a lot of environmental factors, but then also mental health issues often. Mm-hmm. So what's that like to have to support someone who struggles at home and then go to work and be surrounded by it?
I think they're two totally different aspects. And I think we talk about this a lot, especially on CNU. All we do is train to deal with people in crisis and talk about how to use active listening skills and how to make sure that we are making whoever that person is that we're talking to that might be in a crisis feel like they are the only one that is important in that moment, and making sure that they feel heard and that we're not being fake about it, essentially, because people read through that really easily if you're just like, well, I really need to leave right now, but I'm going to try and pretend like I'm going to sit here and talk to you for a while.
Yeah. That big V word.
Being validated.
Yeah.
Yeah.
It's my favorite thing.
It is. But that's what people want. That's what everybody wants. And I think it's different because it's really easy for me to validate somebody that I don't know very well, right? Like, I can talk all day about, hey, tell me about your life. Tell me about your struggles. Let me hear about it, and I'm going to validate you. But it's really difficult for me to do it at home. And I've learned that more and more in my training with CNU.
We've never had this conversation before.
No, I don't think we have. Not really.
You've never told me you're like a perfect law enforcement validator
There's probably a reason I didn't tell you.
And a struggling validating wife.
But
I'm kidding.
We have talked about it a little bit, in that, like, we've talked about using active listening skills with each other to better communicate, and we're not very good at it sometimes.
Yeah, you're right. I'm really bad.
But I'm really bad with you. I am not really bad at work. I'm not really bad with people, and it's what I do all day, right? Like, even if I'm not on a call out in the community with this one person that's struggling in a crisis, I'm in the jail with hundreds of inmates that are stuck in jail, and they might not be in a crisis in that moment, but they might be.
Oh, yeah.
And they might just need somebody to talk to.
Yeah. Well, I can imagine, too, being incarcerated must be just, like, a series of small crises. Like, I can't see or talk to my family when I want to. I can't eat what I want to eat. Right. I'm at the mercy of a deputy who is hopefully nice to me today.
Right.
Like, I have no autonomy, no personal space.
Yeah. Yeah, I mean, the whole thing is a crisis in itself.
It's awful.
People's attitudes and behaviors go up and down all the time, but that's why you kind of get to know people, and we talk about all the time building rapport with people that are incarcerated and kind of learning their baseline, right? Like, so if somebody is super nice to me every single day and we have the same conversations, like, hey, how are you, what's going on, that kind of thing, and then the next day straight up just calls me an asshole, well, that's an issue, right? Like, somebody that normally does that, it is what it is, and I deal with that. But if this person's nice for 2 weeks and then all of a sudden this happens, well, there's probably something going on, and I probably want to figure out what that is and try and help them the best way that I can.
So in terms of mental illness, do you think like the biggest population of people coming through the jail, kind of what their situation or diagnosis might be? Is it substance use?
I would say that it's really hard because of the amount of substance use that's going on when people come in. So is it substance use along with a mental health issue? Probably. Is it a mental health issue that they then started using substances to mask? Probably.
Right.
But for us, it's really difficult to tell the difference. And is somebody having a psychotic episode because they're on drugs, or because this is a normal aspect of their mental illness?
Right.
And sometimes it's really easy because they stay in there for 2 weeks and now their baseline is 100% different when they came in. So yeah, it was probably more substance use than it was their mental health. But that's kind of the thing about jail, is it's different than a prison, or it's different than other places, because these are people that are coming off the street and they might not be on medications and they might be on drugs. And then that changes when they're in custody a lot of the time for the better, but we can't always keep people on them when they leave, so that's the big struggle. One
of the things that you tell me about that I know breaks your heart and completely breaks mine is jail can be like beneficial in that people are, if they're there long enough, they might get sober, and then what they do with that is up to them, right? And I understand there's like a lot of reasons that people go back and use substances, especially if someone's homeless,
right?
Using a substance to be able to stay up for hours and hours on end so that you can make sure that you're safe and your belongings are safe. Totally get it. Not promoting it, right? But I understand, and I can see why people make the choices that they make. One of the things that you've said is so heartbreaking is people get sober. They're at a good place. They're motivated. They're excited.
Right.
They come back through months later, weeks later, years later, whatever it is, and they're using again. And you just see this cycle kind of over and over.
Yeah, it's sadly a never-ending cycle.
For some.
No, yeah, I mean the cycle itself, not for like an individual. Because we don't have the resources to give people to help them. We can try our best to set them up with meds when they leave, appointments with a social worker outside of the facility that are going to help keep them on their meds. But like you said, if somebody's homeless, it's really hard to make appointments.
Or get there.
even if somebody's not homeless, if they don't have transportation, if their mental health makes it hard for them to remember what date they need to go to court or to an appointment, all of those things are factors in getting people the assistance that they need once they leave.
Yeah. So what do you think some answers are that we could make this system better for people with mental illness, since we know that a great deal of folks coming through this system are struggling with some sort of diagnosis and or substance use?
I wholeheartedly think there should be more resources for when people leave. We have a ton of resources in the jail for helping people while they're there and for setting people up in the short term for when they leave. But I think that we could do a lot better in the long term of continuing to help those people. Like if this person struggles to make their appointments, have their social worker or whoever their counselor is go pick them up.
Totally.
And get them and make sure they get there, or make sure they get to their court date so that they don't miss court and come back to jail. I think all of those things we could do better. All of those things take money, which is why it takes so much time to realize that we need to do those things and push for those.
Yeah. So I married you because you're you, right? And you're here and you would talk like this and do this. But I've also been around a lot of your coworkers who wouldn't be sitting here talking in the same way about mental illness that you are. Definitely, I know that they are wanting people to rehab, wanting people to recover and do well, but they're not as patient in the same way that you are. So what is it like to be kind of around a culture that is sometimes a little bit different from who you are, your own values?
I think I go back and forth with it a little bit. I'm really young. I got into law enforcement really young. A lot of the people that struggle with some of the ways that I think about things are much older. And I get it. I don't like change. I don't like things to be different. I like routine. I like the way that things work. And every time you throw something in the middle of that, like, hey, we're going to do this now. We've never done it before. Well, I'm only changing the last 5 years of the way I've done something, right? But a lot of these guys are changing the last 20 years of the way that they do something. And
that's a good thing. I hadn't even thought about that.
Yeah, I mean, if I don't like it and I've only been doing it for 5 years and now they've been doing it for that much longer, having to do something new or change the way that you think about something is got to be hard. I mean, it's a struggle. Mm-hmm. I choose not to always talk to certain people about the things that I like or don't like, or how just the way that my mind works. If I think that it's not going to be a productive conversation. But I also teach at work a lot. So if I'm teaching a class or instructing in some other way, people are super receptive. And I've gotten a lot of good feedback, even from some of the senior guys. They're like, I've never thought about it like that, or I've never done that. Because they respect me and they respect the way that I do my job, even if it is a little bit different than the way that they do theirs or the way that they think about things. So, like, trying to figure out what the best way is to convey that to everybody, right? It's going to be different for different people. One person, I could just go say, hey, you should do this, and they're going to listen. Another person might need a 2-hour class on why this is a good idea and why it works better than what we've been doing for 50 years.
Yeah. I'm really proud of you.
Thanks.
I have more questions.
Yes, I know.
I have noticed that you have really incredible boundary setting skills, particularly where family is concerned. You and I both know that I do not have that same strong level of boundary setting skills. I tend to take on a lot of feelings on behalf of other people.
Yep.
So tell everyone how you can learn those boundary setting skills. I mean, how is it okay for you to be able to say no?
Well, I was not always good at it at all. I was, in my younger life, very much like you, where if somebody in my family specifically is having a moment of need, I was the one to call, right? Like, they're going to call me every single time. I never turned my phone off. I never turned the volume off. It didn't matter what time of day.
I don't do that.
But you are always available. For the most part, you do it. And I was the person, right? Like, I was the person for them to rely on. And I think it's just changed over time. I think a lot of it has been because of you, learning that people are going to be okay, right? If I'm not there to fix everything, I don't have to fix it all the time. That's part of it, and you have that same personality that you want to fix it, but the difference between you and I is you are much more emotionally attached to that fixing it than I am. And I'm not. Like, if I can't fix it, it sucks, but if you can't fix it, it's devastating, and you're going to take on all the feelings of that person that you just couldn't help.
Yeah. So wait, you're saying that you haven't built, like, your entire self-worth around your ability to, like, do good for others?
Right.
Yeah. How profound.
It is. Well, it is. If you really think about it, it is, because that's the profession that I work in, right? But that's what I deal with at work on a daily basis too, and it's never gonna work every time. I can help a lot of people in that moment, and there's a lot of people that I can't help in that moment, and that's normal. But I can't take all of that on. Like, I can't take all those emotions with me. And I would say I've gotten better at it because I work in law enforcement than I used to be, because I separate the two. I can help and not feel like I am responsible for that. And so I think that's helped a lot in my personal life. Also, like, not feeling responsible for my family, and that I'll be here, sure, but I might not be readily available. My phone is never on now. It's on silent 99% of the time.
I have to call your work phone to get a hold of you.
Right. And that's the thing, is everybody knows that. If you're having an emergency, call my work phone. If it's not, I'll get back to you whenever I get back to you. I don't pay attention to my phone as much anymore. But that hasn't really failed me yet. Like, there's not been anything that I missed because of that behavior or that way of thinking.
That's true.
I don't know that I fully answered your question, but...
No, I think you did. I think the question was, how do people start to set better boundaries? And I think what I heard you say, correct me if I'm wrong, is learning that things will be okay if you're not the first person to the scene.
Yeah. Yeah.
Not in law enforcement. Continue to be the first person to the scene.
Yes.
Right, but the other scene.
Yeah, the answering the phone call and saying, yeah, I'll be right over, when maybe you don't actually need to be.
Right.
Or maybe you don't actually need to answer the phone. It just depends on what the scenario is. If somebody needs your attention, they'll call you 10 times. If they don't, they'll call you once and you don't answer, and it is what it is.
That's true. Is there anything else that you want people to walk away from this podcast knowing, either in law enforcement and what it's like, working with people with mental illness there, or what it's like to be a spouse of someone who struggles?
I think I'll focus more on the spouse side, because I don't think I am the end-all be-all for what we should and shouldn't do in law enforcement. But with a spouse or a partner of some kind, I think it just goes back to knowing the line of how far you can push them. And not push them like in a bad way, but push them to get help if they're not getting help. If you can do the research and find good supports for them, maybe that's something they're not very good at, and present them to them so that they can still have a choice and a decision. But also realize that they have to be willing to do that, and they have to be ready to do it.
Yeah, the ready piece, right, is huge.
Yeah.
I think it was September would have been 1 year, so probably like 15 months ago, you kind of gave me, not an ultimatum, but it's time.
Yeah. Because
I hadn't been in therapy for a while and was, truly falling apart.
Yeah.
And you were like, it's time. And so I think I met with 3 providers before I settled on my therapist now, but I think she's saved my life.
Yeah.
Like, I've been in therapy since I was 11 years old, and really 13 years of that kept me alive. But these last this year and couple months with Jennifer has like made me live again.
Yeah.
Like, enjoy my life.
Well, and that's where we learned how far I could push it.
Well, in that way it worked. But we've also had other situations where I was going to 2 days a week outpatient at DBT, seeing Jennifer, my therapist, and seeing my psychiatrist. And at some point I was like, yo, I cannot do this anymore. I can't do all of this. And I decided to drop DBT after a year. And you had to watch me do that.
Yeah, I wasn't a fan, right, when you first did that. I was worried that it was going to go backwards and you were going to drop that and you were still going to feel all right. So you were going to maybe not want to see your therapist anymore. I took it as like you were done wanting to put the effort in. And it took at least a couple months, I think, for me to realize that, no, that's all just really overwhelming to try and do all of that while working and doing everything else that we do in our lives. And that you were still doing just fine without that and doing the other stuff. And then it wasn't like you not wanting to participate. It was just a lot.
Yeah, it was like I needed a little bit of my life back.
Right. Well, and we had lots of conversations about you not even having enough time to do things that make you happy, right? Like you love to run and you love to bike and we love to take the dogs out and go camping. And we were putting a ton of that stuff on hold because you were doing things 3 or 4 days a week.
Yeah.
And
after work.
Right. Is it more important to go to DBT twice a week, or is it more important to have 2 days a week where you know you're dedicating it to doing something that you love?
Right. Yeah, I think I've found a good middle line right now of activities that bring me joy and services that I need.
Yeah.
And it seems to be like the perfect recipe along with some really helpful pharmaceuticals. Was that a funny word?
Yes.
Pharmaceuticals. Some really helpful medication.
Yep.
Pretty good answer, but I don't think I would have gotten to this point if you hadn't have pushed me just a little bit more.
Right.
So thank you for that.
You're welcome.
For loving me.
I will always love you.
All right, enough of the gushy. You ready for the end of podcast questions?
Yep.
Tori, tell everyone one thing that you've got coming up that you're looking forward to.
Christmas.
It's true. It's in 12 days.
For sure. Christmas. We have so many presents under our tree. It's ridiculous.
It is. Yeah. What'd you get me?
I can't tell you.
But
you're going to like it.
Okay. Give us one thing that you want everyone to know about mental health.
I think I'll just go back to what I said earlier about knowing your boundaries with your partner and knowing when it's appropriate to push and when it's not and what's going to help them.
Yeah. And it's like okay to kind of stumble.
Right.
While you're figuring out where those lines are.
Yeah, sometimes it takes a while to figure out.
Yeah. Last question. Give us one reason to stay alive today.
Christmas. It's almost Christmas.
Okay, but what about people who don't celebrate Christmas?
Well, it's snow. It's like the winter season.
It's not snowing in Portland.
And not in Portland, but you're going snowboarding this weekend. Come on now. You go snowboarding. Go play in the snow. Take your dogs to play in the snow because our dog freaking loves
the snow.
More than anything.
Put a German Shepherd in the snow and you'll never see her again.
Yeah.
She's halfway up mountain.
And you'll just laugh the whole time.
Tori, I love you. Thank you so much for your time.
You're welcome.
Hi, everyone. Thank you so much for listening to this episode of the podcast. I so enjoy sharing these stories with you and being a part of all of us talking about recovery. It's such a gift that people come and talk to me, whether in person or by Skype, and allow me to share with you their journey with mental health and the way that it's impacted them. The work that you're all doing with us is helping to reduce stigma and normalize mental health struggles, and that truly means the world to me. If you would like, you can follow our podcasting journey as well as some of the other things that we're up to on Instagram, Twitter, and on Facebook at A Brand for the Broken. Those links are all included in the show notes as well, so you can see that there. As always, I would love if you would rate, review, and subscribe to our show. Your continued support through telling your friends and family about the podcast is so important because it helps us share the stories and ultimately keep people living. It also helps us to find guests who might be interested in sharing their story. If that might be you, please reach out to us and I will get back to you as soon as I am able. You can send us a message through any of our social medias or at stayaliveinc.org. Okay, friends, thank you so much for listening, and I can't wait to share our next episode.